This conference will now be recorded.
Yes, sir.
How are you preparing for your exams? Hello?
No, sir.
So today there will be no big class for you. Just the revision of the previous class only. But I will ask some questions regarding them. I remember very well that you are very much less aware of the classes going on. So how is the exam pattern for you? Number 77.
Good morning, sir.
Good morning. What will be the exam pattern for you? I think Mohanty sir has already explained to you, right?
Yes, sir.
You are complaining not about you. Your general complaint is that the topics covered is much more in ENT, right?
A lot, sir.
So coming to my topics, which one you are going to read? Remember, this is the last class I have told you regarding pharyngeal pouches and grooves. So when it comes to a surgical branch, whether it could be general surgery, ENT, orthopedics, whichever it might be, anatomy is very much crucial for us. Rather than focusing on the treatment and pharmacological methods, our main aim will be complete knowledge of anatomy. So when it comes to your exam, most of the bits we have given are confined to anatomy, right from the embryology till various developments. Are you listening? Hello?
Yes, sir. Yes, sir.
So regarding the embryology, about all these pharyngeal pouches. Wait, I'll choose one bit again. How many bits you are going to get in your exam?
Sir, we were told that we are going to have theory exam.
Not bits, huh? When
No,
was you
sir.
told?
Yesterday, day before yesterday.
Really? How are you going to write the theory exam then?
So they said they'll be forwarding us the question paper in WhatsApp, and then we have to attempt it and in A4 sheets, and then make a PDF of it and upload it in whatever email ID they give us.
Are you serious?
Yes, sir.
So you will be very much genuine in your exam then. Not about you, generalizedly speaking. They told us regarding what about Mohan sir has told the same yesterday? Yesterday class was taken by Sunil sir, right? Hello? You don't remember? Number 77, Vijita.
Yes, sir.
Who told you
నిన్న
this
మోహంతి
part?
సారే చెప్పారు సార్ అది
Theory ana? Prakash? Then మాకు అప్డేట్ చేయలేదు ఇంకా అయితే నిన్న
అంటే
రివీల్ చేశారు అయితే
సునీల్ సార్ కూడా బిట్స్ అని
ఏమ్మా
Sunil sir was also mentioning bits only, sir. Kani Mohanty sir and other department subjects, they said it's going to be theory exam.
Okay, then you might be getting theory only, because there was a meeting at the principal office, I think so. They have decided lately regarding that part. I mean, we contributed some bits for based on our topics, around 70 or 80, of which they told 40 bits will be given for you. I mean, their plan has been different. So how will they conduct the exam then? When is your exam?
So 10th, 12th, and 14th.
10th. That means day after tomorrow.
Yes, sir.
10th is ENT only, no exam? Prakash? Prakash?
ఏంటి సార్
10th ENT అయితే. Okay, we are unaware of that. Okay then. So everyone should have a laptop then to write the exam.
So we can
Can
do
you
it through phone also.
Can you explain how they have told that they will conduct the exam? How did Mohanty sir or the others explain to you? How?
Sir, they'll forward the question paper
Through
I mean,
WhatsApp.
5 minutes before 10 o'clock through WhatsApp, sir.
Okay.
And then we have to write it on A4 sheets. And then before 12, I mean, like around 12 o'clock, we have to make a PDF of all the sheets that we have written. And then we have to mail it to
You
whatever
will make a
email
copy
you
of
give
that.
us.
How will you make a? I mean, you will take a photo of it, right?
Yeah, yes, sir. We'll take a photos of it and then make it into a PDF file and then forward it to whatever email they give us.
How will we know that you are not copying? Mine
I
is a
don't know.
genuine question.
మా మీద నమ్మకం సార్ అంతా
మీ అందరి మీదనే నీ ఒక్కడి మీదనా?
అందరి మీద అయినా కాపీ కొట్టి టైం అంటే ముందు క్వశ్చన్స్ అందరు ఎత్తుక్కోవాలి కదా సార్, చాలా టైం పట్టదు కదా సార్.
మనం ఏం చదవలేదు కదా, మనకి ఏం రానప్పుడు టైం అంతా మిగిలినట్టే కదా.
అంటే క్వశ్చన్స్ ఏమో తెలియదు కదా సార్, ఎవరి దగ్గర టెక్స్ట్ బుక్లు లేవు.
టెక్స్ట్ పీడిఎఫ్లు ఉన్నాయిగా.
పీడిఎఫ్లు అయినా కొంతమంది దగ్గర ఉన్నాయి సార్, అందరి దగ్గర లేవు.
ఆ మాత్రం యూనిటీ లేదా నీ దగ్గర? ప్రకాష్
సార్
ఎగ్జామ్ అంటే ఆ మాత్రం పంచవా?
పంచడం అంటే
I still doubt how this exam will work. And but your answers will explain. If it is very well written, it indicates you have copied. The English framework and all will explain that part. So we will see what will happen. Okay, in my mind, I was thinking of only bits only. I was not aware of that part. Then the question.
అన్ని సడన్ గానే చెప్పారు సార్ నిన్న కూడా.
కొంచెం కష్టం అంటే కాపీ కొట్టడం ప్రిపేర్ అవడం
కష్టమే సార్.
128 మెంబర్స్ వచ్చారు క్లాస్ కి. Okay, then
129 వచ్చేసి.
I will brush up the previous class only. I was unaware of that part. We will discuss the theory for around half an hour. I want you to listen well. Again, I will repeat the questions for some of you as yesterday only. Okay. Coming to pharynx, anatomy and embryology of the pharynx. The development of the pharynx, it is occurs at the time of 4 weeks. It is formed by the endoderm of the foregut. It gives rise to aerodigestive tract and other structures, and glands such as esophagus, stomach, duodenum, and till the liver. Glands include all the salivary glands. It is the inpouching development of the endodermal layer into various organs, thereby forming the salivary glands. Coming to pharynx, which is mainly found by the Pharyngeal Arches, which develop in the 4th week, as I explained earlier, and they contribute to the formation of neck as well as face. The visible structures are at the time of 5th week. Coming to various pharyngeal or pharyngeal arches, they are derived from the neural crest cells, which resemble the fish gills, that is brachia. They begin to develop early in the 4th week, and by the end of the 4th week, 4 pairs of arches are visible on the surface, whereas 5th and 6th gets disappeared. And a buccopharyngeal membrane ruptures, forming the communication between the primitive oral cavity and foregut. Coming to pharyngeal arches, the core of the mesenchymal tissue covered by the surface of the ectoderm and by the endodermal epithelium inside. They commonly form the pharyngeal arches. The ectoderm is skeletal, whereas the mesodermal is the originates into muscles with accompanying nerves. The arterial component is aortic arches. Therefore, each arch carries a nerve, a muscle, a bone, and blood supply. Coming to pouches, they are found by the endoderm. Arch is a arch will be mesenchymal in origin, pouch will be endodermal in origin, cleft will be ectodermal. Coming to first, that is tubotympanic recess, middle ear and eustachian tube, which further invaginates to until the level of tympanic membrane. Whichever layer you will see on the external part of the tympanic membrane is found by the pharyngeal pouch. That is from the first tubotympanic recess. This will be the first pharyngeal pouch, which will converge, which invades further till it forms the outer layer of the tympanic membrane. As you remember, there will be 3 layers in the tympanic membrane, in which the outer layer is found by the pharyngeal pouch here. And the second is the palatine tonsil or palatine fossa, which is found by the second one. You can see this is the second pouch entering and reaching up to the level of tonsillar bed. If you remember, till the level of tonsillar bed, this will continue. But it gets overlapped by the ectodermal tissue such that it forms a single uniform surface. If at all there is a maldevelopment of this formation of complete covering closure of these pouches, this will result in branchial clefts or branchial sinuses or branchial cyst, which if it gets infected with the fluid, infected and forms a fluid, then it becomes a branchial cyst. And the third and fourth are the third is the inferior parathyroid and fourth is the superior parathyroid. So if you assess correctly, third should become at this level and fourth should be at this level. Thereby, third should be the superior parathyroid and fourth should be inferior parathyroid. But embryologically, the third will further go down, whereas fourth will stay where it is. That's why third will become the inferior parathyroid, whereas fourth will become superior parathyroid. Actually, third pouch will go further below to become the inferior parathyroid. And fifth is the ultimobranchial body, which contains calcium producing C cells, which will be not significantly seen in an anatomical point of view. Coming to pharyngeal clefts and grooves, first forms the external aortic meatus and second and fourth are epicardial ridges and cervical sinuses. Sorry, I have mistakenly mentioned pouches as clefts. These will be the pouches. This side is the pouches inside, that is medially, and these will be the clefts. I told the names reversely. Sorry. Coming to arches, from this that is the mesenchymal development, that is the bones and muscles. All these originate from the pharyngeal arches. As you know, from the first one, that forms the Meckel's cartilage. Unanimously, it is called as Meckel's cartilage, from which the mandible, malleus, incus, even the short process of the stapes are formed. Again, stapes footplate is another origin. Only stapes suprastructure comes from the second one. Stapes suprastructure, styloid process, and all the styloid ligaments form the superior horn of the hyoid bone. These originate from the second pharyngeal arch. From the third is nothing but the inferior or greater horn of the hyoid forms the third pharyngeal arch. Superior part of the larynx is found by the fourth, whereas the cricoid is found by the sixth pharyngeal arch. As we discussed previously, the same can be visualized here. When it comes to this image, you can see the development of the various sinuses. Here you can see this is the first pouch, and this will be the first cleft. Joined to, they grow, they meet such that they develop to form a tympanic membrane at the level of tympanic membrane. First cleft will form the external auditory canal or external auditory canal meatus, whereas the first pouch originates from the oropharynx. At the level of eustachian tube, it will invaginate from the middle ear, cleft. Even the mastoid 8 cells and mastoid antrum also, the continuation of the first pharyngeal pouch. Second pharyngeal pouch will reach at the level of tonsil. That too at the level of tonsillar crypta magna, whereas crypts of the tonsil are nothing but the outpouching or invagination of the second pharyngeal pouch. Coming to second, third, fourth, these clefts will be covered or they are completely closed. If at all they are not closed, they will form the various sinuses. And the important point is it always lies anterior to the sternocleidomastoid. This is the important point. Again, anatomy of pharynx originates from the base of the skull to the inferior border of the cricoid cartilage anteriorly and inferior border of the sixth cervical bone, that is posterior. Widest portion is at the level of hyoid, and the narrowest portion is at the caudal end, which is 1.5 centimeters. It's divided into three parts of this: nasopharynx, oropharynx, and laryngopharynx. I want to read this anatomy well so that many questions will be in relation to these parts only. Number 44.
Present, sir.
44 Tejasri.
Present.
Okay, I will point. Okay. I will point out something. You should explain what is this one. Can you tell me what is this one, Tejasri?
Uvulus.
Good. What is this one? This space, this arch space. Or else this one. Don't know? Number 88. Roll number 88. Who is number 88? Absent, huh? Number 110. Roll number 110. Who is roll number 110? Prakash? Here. No one is there. Roll number 120. Hello. Roll number 3. Am I audible to you?
Yes, sir.
Roll number 3. Class start అవగానే అందరూ మాయమైపోతారా?
Three present, sir. 3.
సాకేత.
Yes, sir.
మిగతా వాళ్ళందరూ ఆబ్సెంట్ సాకేత్. 110, 120 ఐడియా లేదంటావా?
Release.
Saket, can you explain what is this one? Can you see the arrow? What is this? What is this one? Okay.
Yes, sir.
Can you tell me what is this one?
Uvula, sir. Uvula.
Friends ఎవరైనా మెసేజ్ చేయమని చెప్పి పర్వాలేదు. This is Ula, right?
88 presents.
88, eh?
Yes.
Where have you gone till now?
Net problems.
So tell me what is this one?
Hyperpharynx.
And this one will be the hypopharynx. I am pointing out only what this one. Only the small part. What is this one?
Epiglottis, sir.
Very good. This is the epiglottis, right?
Yes.
This will be the
Pyriform 4.
very good. This is the pyriform fossa. It is a hidden area.
Yes, sir. Yes,
This is
sir.
pyriform fossa. Number 3. Are you there? 88 నీ పేరేంటి?
Purnananda, sir.
Purnananda. Okay. Hmm. What is this one, Purnananda? Correct. Good.
Styloid muscles.
What is this one?
Parotid gland, sir.
Very good. So what will be this one?
The bony part, sir. It's a mandible, sir.
To be specific, it is angle of mandible. This is parotid. Just below will be the angle of mandible. So what will be here? This is a
Sir?
bony projection. What will be the muscle here behind? If you are in
Stylopharyngeal.
doubt, you can palpate yours only.
I think stylopharyngeal.
మరి అంత confusing it is one of the largest muscle in the neck. Neck muscles lo largest muscle. Largest one of the largest. Purna.
Sternocleidomastoid, sir. Sternocleidomastoid.
Sternocleidomastoid. So it will originate at the
Styloid, bro.
What will be here? At least tell me what will be here. Coming to ENT department, which type of bone will be there? There will be the mastoid tip. Purna. Roll number 3. Wait. Roll number 3.
Sir.
Did you remember what he said? He told just now. What is this one? What is this one?
Sternocleidomastoid చెప్పాడు సార్.
Very good. This is the sternocleidomastoid. Here will be the mastoid tip. This one is the parotid gland, and this one. This is bony one. Roll number 3.
Angle of mandible.
Good. Then what will be this one?
Mandible. Mandible, sir.
Mandible is bone, kada?
Sir.
So what will be here? What will be here?
Submandibular gland, sir.
Good. Submandibular gland. So this is the parotid gland. This is the angle of mandible. This is the submandibular gland. This is the sternocleidomastoid muscle from the tip, inserting into the tip. So what is this one? This white one?
Nasal septum.
Good. Posterior end of the nasal septum. Which bone will be there? Posterior part of the septum is bony or cartilaginous?
Cartilaginous.
Purna. Internet problem only. So posterior part of the septum is bony in origin. Do you remember vomerine bone? Vomer. What is this one? Can you tell me what is this one? Are you there? Can you listen me? Hello. Hello. Roll number 3.
Sir. Sir.
Invistunna?
Sir.
You have answered well all this part. This is the septum. Fine. What
Yes,
are
sir.
these two then? What are these two? What is this one? What is this one?
Turbinates.
Which turbinates?
Turbinate.
Very good. Very good. Which turbinates?
Inferior.
Below is the inferior turbinate.
Sir.
This one? Middle turbinate.
Middle turbinate.
So how many turbinates we have total?
3 pairs.
3 pairs. Good. So where is the superior turbinate?
Superior
Can
turbinate.
you see here?
No, sir.
Normally,
Not
superior turbinate is not visible in the posterior rhinoscopy. Rarely, in case of atrophic rhinitis, superior turbinate can also be visualized. Rarely, not always. Okay. Now, what is this opening called? This one.
Opening. Pharyngeal opening.
No. Who is your best friend? Or number cheppu?
Yes.
Aleti Krishna Saket.
Sir.
These two are the turbinates. If this is the septum, what is this one called? Circle called. Vestibule anterior untundaga. Idi posterior undaga. Vestibule will be in the anterior now. What is this entire thing called? This circle called. I know you cannot read these labels. That's why I am confidently asking regarding this image only. Number 4 avaru?
No, sir.
Number 4.
Sir, opening coin.
Very good. Coana. Posterior coana. Coanal opening. Very good. This one and this one. This entire thing is called posterior nares or coana. Very good. So if this is the coana, if this is the septum, these are the middle and inferior turbinates. What will be this one? Supriya? Roll number 4, Supriya. Supriya, off your speaker. Supriya.
Sir.
Can you tell me what is this one? I have placed an arrow.
Pharynx.
Huh? What is this one, Supriya? Oh, you are just reading this one, nasopharynx. Very good, very good. Supriya, are you there?
Sir. Parotid
you are
gland.
reading, Good. What is this
Parotid
one?
gland, sir.
Good.
Parotid gland, sir.
This one just adjacent to parotid gland.
Sterocleidomastoid muscles.
Sterno, not stero.
Sternocleidomastoid.
This one.
Mandibular.
Good. Angle of mandible. This one.
Mandible of mandible.
Mandible of angle kadamma.
Angle of mandible.
Good. What is this one?
Submandibular gland.
Good. You're answering well. What is this one? Vinnavaithe mundanta class.
Parled. Nasal septum.
Found by bony part or cartilaginous part?
Sir?
Nasal septum. It is found by the bony part or cartilaginous part? Which part?
Bony part, sir. Bony
Good.
part.
Can you mention the bone which is involved in it?
Vomer bone.
Very good. What is this one?
Coana.
Okay, good. Coana. What can you see in this coana? All these two structures.
Turbinates. Middle turbinate.
Middle and inferior turbinates.
Inferior turbinate.
Good, very good. So what will be this one? Just laterally adjacent to the coana.
Eustachian tube.
Eustachian tubal opening. Very good.
Open.
Can you specify what is this one? Where my arrow stopped? Just above this eustachian, just above and posterior to the eustachian.
Sir. No
Roll
idea.
number. Good. You have answered well. Roll number 5. Who is roll number 5? Roll number 3. What is this one then? Your friend told just now.
Pharyngeal fold.
Pharyngeal fold, eh? Oh, sorry. Okay, fold only. Eustachian tube opening it is. Just above here will be the fossa of Rosenmuller.
Yes, sir.
Nasopharyngeal carcinoma originates at this level. Fossa of Rosenmuller. Okay, na?
Yes, sir.
What is this one? This dark one, inside one. This is the ulna, right?
Sir.
What is this one?
Root of tongue.
Good. Base of the tongue. Base of the tongue. You can also see the palate and villi, circumvallate villi. What is this one? Small one.
Tonsil, sir. Palatal tonsil.
Very good. Very good. What is this one? Arc-like continuation. What is this one?
Pharyngal arch.
Good. Okay, very good. Palatopharyngeal muscle or posterior pillar of the tonsil is also this one. So palatopharyngeal, very good. If you can tell this one, you should also tell this one. What is this opening?
Eustachian tube opening.
Okay, then what is this one in continuation?
Folds, pharyngeal fold.
Salpingopharyngeus. Salpingo means eustachian tube. Muzzle extending
Yes,
till the pharynx. Salpingopharyngeus. This is the palatopharyngeus, no? You told palatopharyngeus. Then this will be the salpingopharyngeus. Good. So what are these things? This V junction. This junction. What is this one? What will be this one?
Cartilage.
What cartilage? Very good.
Larynx.
Very good, sir.
Inlet of larynx, sir.
Inlet of larynx, formed by what? Which part of inlet of larynx? Roll number 2. Roll number 2. Absent, huh? Roll number 5.
Present, sir. 5 present, sir.
Yeah? Okay, 5.
Yes, sir.
You are listening the class now. What is this one? Can you see?
Epiglottis, sir. Epiglottis.
Good. Upper margin of the epiglottis. Then what is this one? This small. This junction. What type of cartilage is formed? And what cartilage? Name the cartilages things.
Arytenoid, sir.
Very good. Very good. Very good. Well answered. These are the arytenoids. This is the upper margin of the epiglottis. So if these are the arytenoids and if this is the epiglottis, what is this one? Pooja?
Epiglottis folds, sir.
Good. Airy epiglottic folds. Airy epiglottic folds. All these combinedly form the inlet of the larynx. Okay? Inlet of the larynx is the airy epiglottic fold. Very good. But what is this one, Pooja? Just now I have told to Ankit, roll number 3.
Salpingopharyngeus, sir.
Good. Salpingeo means eustachian tube till the connecting the pharynx muscles. Salpingopharyngeus muscle. This will help in opening of the eustachian tube. When you yawn, the eustachian tube opens due to the action of this muscle. One of the action of this muscle. Okay, very good. I think most of you can answer the anatomy. Usually you are not habituated to see the anatomy in this point of view, from the posterior point of view. That's why I have more focused in explaining all these anatomical parts. And I am very much aware that you will not listen to my class. So I thought of getting some feedback from you. Okay then. Roll number 101. Who is roll number 101? If you observe this one, this is also the same image, but not in a much open view. Same image. Roll number 5. Pujita. Hello.
Pooja sir. Pooja sir.
Pooja. Okay. Can you get orientation to this image? Same as the previous one. What is this one?
Tongue sir.
Okay, anterior 2/3 of the tongue. What will be this one?
Circumvallate.
Circumvallate papilla. So what will be this one? Number 3.
Sir,
You have answered this one in the previous image. What is this one?
root of tongue.
Root of tongue. Okay. Base of tongue.
Base of
Posterior
tongue.
1/3 or base of tongue. What type of lymphatic structures you will see here? You are answering well. That's why I'm asking much. Pooja, you can also answer. What are the lymphatic aggregations here called as?
Tonsils.
Good. Lingual tonsils.
Lingual tonsils.
To be more specific, lingual tonsils.
Yes, sir.
Okay. Aleti Krishna kada ni peru? Aleti Krishna. What is
Saket
this one?
tonsils.
Saket. Your friends call you as Saket, eh? Okay. What is this one then?
Yes, sir. Opening of
Opening only. I'm okay. As you remember, Pooja told what is this one?
Area
Epiglottis.
epiglottic fold.
Area epiglottic folds will be lateral. These are arytenoids. This is epiglottis. I can see
Yes,
a
sir.
small vertical ridge connecting between the tongue and epiglottis. This is the epiglottis.
Yes, sir.
What is this one? Sorry, it is not Prassana ridge. Good point, but Prassana ridge comes under posterior pharyngeal wall at the junction of the oropharynx and nasopharynx. So what is this one? A small vertical ridge. So everybody are aware of this.
Glossoepiglottic folds.
Good. And after finishing the tongue, that is glossy. From here it will start. A vertical ridge is present connecting the epiglottis. So it is called as glossoepiglottic. A small fold. It is glossoepiglottic fold. So what lies on either side of this glossoepiglottic fold?
Vellucella.
Alecula. Who is it? Alekia? Good.
Yes,
Very good.
sir.
So why is this glossoepiglottic fold formed? How does it help? Why are we having vallecula? Mere knowing or mere labeling the anatomy is not correct. If you understand the anatomy, if you observe why this muscle is present, why this cartilage is formed, why is it having this shape, why is it located here? So everything has its own purpose or its own function. So why do we have this epiglottic fold, glossoepiglottic fold? Why do we have vallecula? Any one of you can answer. I'm asking just a simple question, a logical question. Did you get my point? There will be a function of everything. It should have small orientation. Why do we have vallecula then? So what is the main function of epiglottis? Does epiglottis have any function? So when the food is masticated and to form a semi-solid or soft bolus, the tongue propulses the food particles into the level of posteriorly up to the level of vallecula. Here, this vertical ridge or glossoepiglottic fold will divide the food into will divert the food into on either directions at the vallecular level on either side, and because of this the food is diverted laterally. Meanwhile, this epiglottis will move further posteriorly and the larynx gets lifted such that the epiglottis will close the laryngeal inlet while deglutition of or while swallowing the food. From the vallecula, the food is diverted laterally from on either side. It could be left or right. It is diverted laterally into which? What is this one? Are you listening? Number 3. Hello. Number 5. Connection lost or what? Number 6.
Sir.
కనబడుతుందా? Okay then. We'll finish it off. So the food is diverted from the oral cavity into the vallecula, where the glossoepiglottic fold divides it. Thereby, it will direct the food into the piriform fossa. This is the area. This dark area is the piriform fossa. Then area from which it will travel into the cricopharynx, into the esophagus. Cricopharyngeal esophagus junction to esophagus. Okay then. today I have asked many questions. Means I insist everyone to be good at anatomy if you are interested in any surgical branches in future. Even though anatomy will play major role. Just a revision of the topics today. Hope we'll end the class now. It's already 10:20. Sir, Prakash,
సార్ చెప్పండి
అది అటెండెన్స్ వాళ్ళు తీసుకుంటారు కదా,
సార్.
రికార్డ్ అవుతుంది కదా, ప్రాబ్లం లేదుగా. Okay, all the best for the exam, your theory exam. I don't know how you will write or how you will answer. Take care. Okay then, bye.
థ్యాంక్ యూ సార్.
Bye bye. Pooja, roll number 3.
Yes, sir.
Thank you, answered well. Roll number 4 also.
Thank you.
Bye bye.
Thank you, sir.